The cost of healthcare is rising faster than American wages, according to the Kaiser Family Foundation. The modern-day patient is responsible for 30% of healthcare services. That places them within the top 3 largest payer groups in all of healthcare, just behind Medicare and Medicaid. All those statistics highlight where patient responsibility stands today. It's not an easy scenario for many patients, yet as the healthcare provider, you have no choice but to follow the trend. It would be nice if you could wave a magic wand and change your client's financial responsibilities, but you're not a miracle worker in that sense. The reality is that most successful organizations, hospitals, and practices have a cohesive and detailed medical billing process in place. In order to operate, you need a steady stream of revenue. At the end of the day, you're a business. Yes, if you're a doctor, the sole reason why you spent all of those years as a med student was so that you could enhance the medical field and treat patients. But you can't continue any of that without some form of income. Hi everyone, I'm Matt from eTactics, and today I'm going to give you 4 hacks for creating medical collection letters that convert. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. Collecting from patients isn't easy. In fact, 63% of all medical debt isn't ever collected. That could be due to the fact that many collection letters that get sent in the mail just don't grab the recipient's attention though. That's why my first hack for you is to create something that catches the eyes of your recipients. Direct mail marketers swear by a technique known as the 3-33 rule. In essence, it states that you need to make your envelope stand out from the stack in 3 seconds or fewer in order to avoid the garbage. Further, you have 30 seconds to engage the reader and then 3 minutes to prompt a response. Although this rule pertains to promotional material, it's still an effective strategy to keep in mind when writing a collection letter to your patient. My next hack for you is to make sure that you know what information should always be included in the collection letters that you send out. After you've designed the letter in an eye-catching way, it's time to begin the drafting process. Luckily for you, collection letters aren't unique to just the medical space. Now there's an entire industry that's devoted to trying to collect bad debts on behalf of other businesses. Why not use the knowledge from those existing businesses to your advantage? Do some research online and find pre-existing templates for collection letters and create a foundation for yourself. Include information like account number, balance due, account status, patient responsibility, due date, office hours, and any financial relief options you may have. All those data points help paint an obvious picture for the recipient of the collection letter that you're sending. In essence, they help say your payment is way overdue and you need to pay us soon or you'll face some consequences. The third hack I have for you is to watch your tone. The tone you use in a medical collection letter matters tremendously. It's a sensitive topic, especially when you consider statistics from Kaiser Family Foundation that determine sacrifices patients make for their medical bills, like 37% borrowed money from family or friends, 34% increase their credit card debt, 70% cut back on spending on food, clothing, or other basic household items, 41% took an extra job or worked more hours, and 59% used up most of all of their savings. If you're sending a collection letter to a patient, they've received their original statement multiple times by now, and you're making your last-ditch effort to get payment from them. But that doesn't mean you need to come off as annoyed or intimidating in the tone of your letter. My final hack for you to keep in mind when creating medical collection letters is to pick a channel. People have different preferences for their healthcare experiences based on their generation. As a result, the channel or channels you use when sending your medical collection letters matter. Maybe you have a delinquent patient who's a little bit younger and you've only sent them statements through the mail. If that's the case, it probably would have been helpful for you to know that millennials spend around 6.4 hours per day checking their email. In other words, you might have had more success with this account if you knew that statistic. So send your letters to patients in formats that they're most likely to read. Trying to collect from patients isn't an easy process. In a perfect world, they pay any outstanding balance they might have with you the moment they receive their first statement. Yet, as you know, it's much more difficult than that due to a variety of reasons that I briefly covered in this video. The reality is that you need to collect from your patients in order to keep your doors open. So sending collection letters is a necessary part of the job, and you now know how to draft up an effective one that's reflective of your practice and empathetic in nature. If you'd like to learn more about designing effective medical collection letters, reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below. What are you waiting for? Subscribe to our YouTube channel.